The crisis surrounding drug prices, prescription drugs for those battling diabetes, are skyrocketing.
Maryland Congressman Elijah Cummings, he blasted out new numbers this morning showing what those in his district are left to deal with, putting their lives at risk. For the past few years, it's been Congressman Elijah Cummings and his team leading the charge against drug prices that continue to soar.
How disgustingly outrageous these drug prices have become.
On Wednesday, Cummings blasted out a committee staff report showing how millions suffering from diabetes in the U.S. have faced steep increases in the cost of their insulin. Cummings found in the Baltimore area more than 42,000 Medicare recipients would pay 92% less in Australia, 88% less in the UK, and 87% less in Canada. The price difference between the countries specifically because Medicare is not allowed to negotiate directly with drug makers.
We cannot simply sit back as diabetes patients are compromising their health and even dying due to the high price of the medications.
Doctors like Sharita Golden watching the everyday battle.
As the cost of insulin has climbed, I've witnessed firsthand the financial toll that it's taken on my patients.
The report is just the latest effort to highlight what has become a bipartisan cause in Washington in recent years. Cummings has since launched a sweeping investigation in the drug industry's pricing practices and introduced a bill to allow the federal government to negotiate lower prices. Elected leaders say every day that goes by without a change leaves lives in jeopardy.
Literally, people are rationing and some people are dying because they cannot afford these prescription drugs. That's obscene. In the wealthiest nation in the world, that is obscene.
Now, Cummings' report shows just how bad the issue is for Americans. There are more than 30 million people with diabetes, including more than 1 in 4 seniors.